DermaHug is a fabric backed with a tacky silicone gel surface that, when stretched across an incision, increases comfort and reduces risk of dehiscence by eliminating tension on the incision. It is a tightly woven nylon and lycra fabric that is hypoallergenic, latex-free, and easily conforms to the patient's size and shape. DermaHug is a single-patient reusable product available in several shapes and sizes and can be easily adjusted or left in place for 2 weeks or more. And because it is hydrophobic, it can be worn in the bath or shower. Hospitals and wound clinics achieve higher patient satisfaction scores when patients report increased incisional comfort when DermaHug is in place. Another significant benefit is a decrease in the complication of dehisced incisions because it eliminates lateral tension on the incision. DermaHug products can be easily modified or adjusted for size and shape. Best of all, DermaHug safely secures your dressings without tape. Its silicone tackiness won't cause a contact sensitivity reaction or skin stripping. It's very gentle on the skin and leaves no residue. As mentioned earlier, applying DermaHug eliminates tension on the incision or wound, which results in increased comfort and decreases the risk of dehiscence. In the case of a dehisced incision or pilonidal cyst excision, wound care will be performed and the dressing will be applied before applying the DermaHug. DermaHug can be applied to the patient in either a prone position or standing, but once the patient is standing, adjust the DermaHug to its final placement. First, apply the dressing to the incision or wound. The DermaHug should be applied to clean, dry skin free of powder or lotions. Then, invert the DermaHug and remove the liner backing from the silicone gel. Attach the silicone side of the DermaHug to the skin on one side of the incision or wound. Then, gently stretch the DermaHug and adhere it to the skin on the other side. Ideally, for pilonidal cysts, the DermaHug should be applied with the patient standing. However, whether applied while standing or in prone position, the fabric should be taut as it transverses the incision or wound. It is adjustable, so to adjust the tension, simply lift the DermaHug from one side and stretch or loosen it before reattaching it to the other side. The arrows indicate the action of how DermaHug supports the incision or wound by stabilizing the peri-wound tissue, which results in increased comfort, decreased incision dehiscence, and expedited healing. This video demonstrates how easily DermaHug is applied to the patient with a pilonidal incision.
We're good.
Okay, so you put it on one cheek,
All right.
stretch it over, and put it on the other. How does that feel?
All right. Yeah.
Again, make sure the skin is clean, dry, and free of powder or lotions. To remove or adjust the tension, gently peel back one side of the DermaHug and reapply. Then, smooth it down to the skin. Patients are immediately more comfortable wearing the DermaHug than with other devices. For example, the simple actions of sitting or standing are more relaxed when DermaHug is applied to the buttocks or abdominal area. Frequently, the first thing patients say when this device is put in place is, "It just feels better," because the incision area is more comfortable with tension decreased. Wound care professionals are the MacGyvers of medicine. Look at this example of how the DermaHug 1018 was modified to accommodate the ostomy bag. The patient was significantly more comfortable with DermaHug securing her dressing. DermaHug also accommodates other procedures and wounds. Here are other applications of DermaHug. Again, notice how the clinician modified the size and shape to accommodate the application areas. This patient's belly is very distended, and there is only a narrow bridge of skin holding the incision together beneath the DermaHug butterfly. It may be difficult to see, but this patient had an at-the-knee amputation in which the posterior flap incision dehisced. The DermaHug was used to help secure the flap during negative pressure therapy. The irritation redness you see here under the dressing is from the tape originally used to keep the dressing in place. Where patients suffered discomfort and adverse reactions from tape, DermaHug provides a comfortable alternative with no sensitivity contact reactions. In fact, to date, there have been 0 reported skin issues. And if the DermaHug becomes soiled, it can be washed with mild soap and water, rinsed, and air or towel dried. Then reapply. The tackiness will remain. Consider the impact these simple devices can have on your patient's experience. Learn more about DermaHug tissue stabilizing products and take the first step toward better patient outcomes and increased patient satisfaction.